friends, I am Dr. Pramod Jog, pediatrician from Pune, professor of pediatrics at the D.Y. Patil Medical College in Pune. I have been the past president of the Indian Academy of Pediatrics in the year 2016. Today, we are going to discuss some important aspects of cough in the pediatric practice. All of us are aware that cough is an important symptom of respiratory illnesses in children, particularly acute variety of cough, which is associated with the viral acute respiratory infections, which are seen in conditions like flu, common cold, and even COVID-19. This particular cough is usually of the dry type, and it is quite disturbing. The child doesn't sleep. He has problem in the school. He cannot play properly. In fact, while feeding, if he coughs, he brings out all that he has eaten. The parents are very anxious. Even their sleep is disturbed. And my dear friends, it is important to suppress this troublesome cough. Okay. Of course, if the cough is productive, we never suppress that cough. In fact, cough is a complex reflex phenomenon. There are peripheral cough receptors in the respiratory system, which extend from the larynx down to the bronchi. They are also present in the paranasal sinuses and also in the external auditory canal. The reflex is mediated through the brain stem. The cough suppressants basically are of two types. There are opioid cough suppressants and non-opioid cough suppressants. The opioid cough suppressants obviously have their action like opium, and that is why they are addicting, they are narcotic, they also produce respiratory depression, and they can produce constipation. Dextromethorphan is an example of a non-opioid cough suppressant which has central action through the sigma receptors and the NMDA receptors. However, because the action is on the NMDA receptors, it is also associated with drowsiness, dizziness, and hallucinations. Noscapine acts centrally on the sigma receptors as well as peripherally on the receptors which I just told you. Now, an ideal antitussive should be free of all these side effects. It should not have all those side effects of opioid suppressants like fulcodine, which are like narcotic action, addictive action, and so on and so forth. Noscapine has been used for quite a few years. It is recommended by the Dutch GP Society for use in children under the age of 2 years for symptomatic cough. It has a very good safety profile, and the onset of action is within half an hour to 1 hour. One more important point about noscapine is related to COVID-19. These days, we have been discussing about the ACE2 receptors in case of COVID-19, and bradykinin-mediated cytokine release and the inflammation of the lungs is always seen. Noscapine relieves the ACE inhibitor-induced cough in 90% in 1 week. This is an important additional benefit of noscapine. So, my dear friends, giving the meaning to each of the alphabet of noscapine, let us remember that noscapine is a non-opioid suppressant of cough, acting centrally as well as peripherally, an ideal antitussive with no impact on the respiration, no addiction potential, and the efficacy profile in pediatric age group extending right up to the treatment of dry cough in COVID-19. Thank you.